Bismillah ar-Rahman ar-Rahim, my dear MRCS candidate. This is the lecture number 3 in the series of how to pass MRCS with examiner and artificial intelligence help. And I hope this part will cover some more of the initial information about MRCS, how we communicate with each other through a Telegram group, which you can ask any question you like, and I will be answering all your questions. With this QR code, you can join the group. It's public group, and I now have 10 volunteers for virtual OSCE station. Hopefully, we start the testing from next week. First come, first serve, and this is the Google form that I have created for this reason. If you join, you will be enrolled according to your priority of how early you have joined. Now, I think this course will crack the difficulty of the code of MRCS. Some candidates fail due to certain gaps in their knowledge, but they are not a bad surgeon. And really, as an examiner, I feel very bad when they don't pass. With the help of artificial intelligence, which a lot of candidates doesn't know how much they can offer for help, and with my 15 years experience in MRCS examination, I hope to help you all to pass, and at least to know before the exam if you're going to pass or you better defer for a later date. I will summarize to you what you need to know in order to pass safely. MRCS shouldn't be a nightmare. It's an easy, straightforward, fair exam. It's very frequent and it has big number, big demand all over the world. And they are assessing both your knowledge and your skills and your communication skills in a very fair way with multiple examiners. It is as fair as humanly possible exam could be. This course is interactive, so please put your question into the Telegram or YouTube station, and hopefully this is a lot better than a crash course for 2 days, just 1 week before the exam. You can't jump your level just by 2 days. But if you have 5 or 6 months continuous monitoring, continuous improving, continuous getting advice, I think it's a lot better. And with artificial intelligence, it will give us an idea of how to pass a station, which books you need to read, how to prioritize your answer, and what is the best answer, and how to get the style of passing MRCS exam. I will follow all the Royal College guidelines of Code of Conduct for examiners. In the Code of Conduct of the Royal College, because I know the Royal College is very accurately monitoring all what is happening on the social media. As mentioned in the Code of Conduct of examiners, that most examiners will be engaged in activity of teaching trainee. Examiner must ensure that the integrity of the examination is preserved, which I will definitely do, and there is no confidential information that you will get out of this course that any other candidate wouldn't have. As I mentioned, the Code of Conduct is 4 lines, which I did discuss before. All of them, these are for me that I will follow in this course. No privileged knowledge will be given to any examiners, and all the material that I have gained through the examination is totally confidential. There is no repetition of any OSCE station in the exam, but there are similar stations which are found in the books with the help of artificial intelligence, and this will help you to pass the exam safely without contradicting the Code of Conduct as an examiner. why I'm going for MRCS exam. I think this is important for you to put for you in front. It's a great step in your career. It's a great privilege to put it in your CV when you pass MRCS exam. It's an internationally well recognized exam, and it will make you able to work in United Kingdom, and probably your first salary will be between 3 to 4 thousand British pound per month. It is better, I think, to surgeon than BLAB route rather than passing the BLAB test, which are 3 stages, and then to have GMC registration and then looking for a job as CT1 and CT2. I think it is better to pass MRCS exam, which you can do it totally outside UK, so it's not that expensive. You don't need to travel. And then you can have GMC registration and start applying for ST3 and ST4 and continue with your career. It saves you BLAB and then going for MRCS and then going for FRCS. So you go MRCS, and at the end of your training, you finish by having FRCS of vascular surgery, which I hopefully will make a course after that. It will open the route for you to success in your career. You can work in UK, you can work in Europe, you can work in New Zealand, you can work in Australia with MRCB. After joining the GMC registration, you can also work in Ireland. It's a very good career step if you want to progress in surgical career. How much do I need to study? If I ask artificial intelligence, this is the answer that you will get. And let me show you how to ask this question, the artificial intelligence. So let us say that you will go to Gemini, which is a free artificial intelligence by Google. It's very easy. You can use it free of charge. And if I put the question, how much time do I need to study for MRCS Part B examination from reliable sources? The answer is it can depend on several factors. Your existing level of knowledge, which is true, and the resources that you use, either you are reading from reliable sources, effectively MRCS, and your preferred learning style for active study. However, in general time frame based information of the various resources, between 1.5 to 3 months is very tight time frame. Would like to require very intensive study, potentially full time. 3 to 6 months I think is a correct answer, more realistic time frame for most candidates, because most of you are working in hospital. So I would think 5 hours study a day should be good to prepare you. 6 months is the amount of time which most artificial intelligence will give you as an answer. So you can see the answer from artificial intelligence is between 4 to 6 months concentrated effort to prepare for MRCS Part B exam. Daily study session 2 to 4. I think 2 sessions of study per day will make you reach to that level and that skills. Now again, if you ask artificial intelligence, which books should I read from? It will divide you into core textbooks, and here are the textbooks that you should read for this exam. And this is the most reliable sources, again, from Gemini Artificial Intelligence. The first book, Clinical Examination and Communication Skills for MRCS by B.H. Miranda. All of them are available over the internet. Some are free and some are paid. Second book, Get Through MRCS Anatomy by Simon Overstall. The third big book is Oxford Handbook of Clinical Surgery by Mary R. Owen. These are the core 3 textbooks that you need to read. Now here are 3 additional resources, which is OSCE for MRCS Part B, Belly and Love Revision Guide by Jonathan Fishman. and Mastermind for MRCS Part B by Christopher Vaughan, and Revision Surgery by Paul Jenkins. All these 3 books are available over the internet. So these are the picture of the 3 books that you need to get for the core resources of the exam. And these are the summary of the station. We mentioned that you will be tested 18 stations distributed over these fields: anatomy, applied surgical science, clinical and procedure skills, and communication skills. And the beauty is that all related information to MRCS is found on the website of the Royal College. If you go www.intercollegiatemrcsexams.org .uk MRCS exam overview, you will find a document which is about 20 pages covering all aspects of MRCS. I advise you to read it thoroughly because it's extremely vital and very important. How you are being assessed in each OSCE station, which I will do to you, you will be assessed in 2 ways. The first way is a structure mark sheet. So every step that you do have a mark equivalent. If you wash your hand, introduce yourself, be kind to the patient, ask for permission to examine, permission to take history. If you feel any pain, let me know. All this is being marked. You will also mark it for your professionalism. How professional you do your job as a surgeon. All this is standardized, distributed by mark across the board, and is being filled by the examiner. So there is mark out of 20 mark. Each station have 20 mark, and this is the mark that you get from it. Other than that, you are assessed either your pass or fail or borderline according to your performance. They don't necessarily go hand in hand, not necessarily high mark equal pass or low mark equal fail, because they measure your performance in 2 different techniques. And what I will do with the virtual station, I will give you your mark and your overall assessment and tell you if you pass this station or not, and why you didn't pass this station and why you did pass this station. So I think passing MRCS is very, very easy. You should not fail this exam at all. I feel very bad for anyone who doesn't pass first time. If you're well prepared, you should pass, and we will discuss over the next few lectures some of the common OSCE station with the help of artificial intelligence. I wish you all the best, and looking forward to help all candidates to pass their exam. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon.